Hi, I'm Shelley Power, and we're going to review today the Polestar Pilates fitness screening. You can find that screening in your principal's manual toward the end. And we're going to go through all of the tests, all the grading and the scoring, and help to bring some clarity to the information that we're looking for, looking at, and how we can interpret it to go on and make our exercise plans. So the first part that I want to go over in the principal's manual is just the general grading sheet, where you're going to log all of the scores and all of the information. So when you start filling this out, it's important to do a good job of getting as much information from the client as possible, because that's going to help you to know more about them and how to create a session for them that they're really going to enjoy and it's going to be safe for them. You're going to get their health history. The things that you record there are past surgeries, injuries that they're still dealing with. If it was something long ago that doesn't really affect them now, that's not as important. But if they hurt their knee 6 months ago and it still bothers them, that would be some information that you would want to record here. You would also record if they have osteoporosis, if they are pregnant. If it's a woman who's pregnant, that's going to affect how you create their program. Any other things that you can record there. You have their fitness history, that's the next line, and that's where you're going to record what they do exercise-wise. So they're a runner, or they're quite sedentary, they don't do that, or they swim, or they hike. What are they doing right now in terms of fitness? So that's what you'll record there. And then you're going to record their personal goals. And this is really important because this tells you a lot about what's motivating them to be in Pilates, why they're coming to you for this class. So you're going to write down often things like they want to improve their flexibility. Sometimes people are interested in improving their posture. They want to get stronger. Anything could go there. So again, that's where you're going to record that. And that's going to help you tailor your program so that it really meets their needs. So they're both under the impression that you're working on these things, and then you really are, right? So you're including that into their program. You're going to record all of your test scores, and I know on video you probably can't see the writing on here, but you have all of your test scores and the tests listed with the 0, 1, 2, and 3, and you're going to circle that score and then write as much information as you can to the side. And I tell people to do this, one, because it helps you remember. If you're working with a lot of different people, you may not always remember every little bit about this person. It also helps, though, if you're going to share clients with someone. So I may do the screening, and I know what I'm thinking in my head when I circle the scores, but that might not carry over enough to the person that I'm going to hand it off to. So the more information that you can record, the better. Okay? The 0 you'll see is for when somebody can't attempt the test. That example would be if somebody had osteoporosis, and we would not have them, it would be unsafe if they did the roll-up. So we just wouldn't test them on the roll-up, and they would get a 0. It could also be possibly for somebody who's pregnant, who is coming in, and you're doing a screening on them, and they may not attempt all the tests. They may not be comfortable lying on their abdomen or something. So you give that a 0. Everything else, you're going to score the 1, 2, and 3 as it's stated throughout the screening. You're then going to list your problems and your goals below that. So the problems are things very clear, like decreased hamstring flexibility or decreased core strength. It's not a narrative of why you think they have these things, it's just the information. And then the easy way to go into your goals is you want to improve all of those things. So the problems and the goals look very similar. You're going to have the same items listed in the problems and the goals, and you're going to say in the problems it's important not to just write down thoracic mobility, but you want to say what's going on with it. So if it's a problem, you're going to say it's diminished or decreased. And then when you get into the goals, you're going to say you want to improve those things or somehow make them better, whatever word you like to use to describe that. Okay? And those are your problems and goals. The other thing where we find that the students sometimes don't put this information into the goals is the personal goals. So you want to make sure that in all of the goals for the session that you're representing what you find on the screening and you're representing their goals. And that's going to help you, again, to make a nice, well-rounded workout for your client. All right? In the part just between the goals and the actual screening test, you'll find a section when you look in your principal's manual, that has to do with the scoring of the entire test. And it gives an average score. We divide by 15, and it gives an average score. And we're starting to use this beginning, intermediate, and advanced a little bit less because it was sometimes confusing as to the client's ability. Was it that the person was kind of a beginning level, or was it they were a beginning level in Pilates? So more we want to use this guide, all of the different tests. When we retest our clients, we're just going to look right at the goals that we're setting up based on these problems, and not so much at the beginning, intermediate, advanced. So you can leave that off. And in the new manuals, you'll find that that's been taken away, so we don't have that in there anymore. It's just a total score. All right, so we get into the screening now, and I'm going to have Ileana help me with this. And we're going to start with the half squat. All right, so now we're going to go into the individual screening tests, and I've asked Ileana to help me with that so I can be explaining what's going on and might point to some certain parts of the body and bring attention to that, and she's going to go through the movement so you get both views of it, how the body is supposed to be aligned and where you're going to put your attention. So Ileana, go ahead and come over and just stand right here facing me. And we're going to start with our first test, which is the half squat. And this is a really interesting test because it's one that people do a whole lot of things other than what we want, which is very simply just to bend the knees and straighten the knees. So you'll see all kinds of different things. So Ileana, take your arms and stretch them out in front of you and just hold there. The feet, when we're setting up, are going to be about hip width apart. Her arms are stretched out and she's just in a natural standing position. Bend your knees and go into your half squat, and you're going to hold there. Now, as a teacher, I want to walk around because what I see from the front might be really great or might, need some, notes that I'm going to make about how it's going to be, but I am going to see different things when I walk around. So I'm watching her from all sides, and I'm going to have her hold around 20 to 30 seconds. If you see what you need to see and they've held for a certain amount of time, that's fine. You can have them come back up. So some of the things that I'm looking for are her general torso posture. So ideally, when she bends her knees, or when your clients bend their knees, you're going to see that the body remains upright and there's a disassociation. So she's able to move in her legs without changing the position of her body, the disassociation in the hip joint. So let's do that again. So stretch your arms out. And as you bend your knees, slide straight down and then come back up. So you can see as she went into her squat, she maintained her vertical position for a good amount of it. And then as she went lower, her body started to tip a little bit forward. So this time, for the sake of what we're doing here, I'm going to give her a little bit of information. And we wouldn't normally do this on the test because we want to see what people's natural tendency is. But I'm going to help her so that you can see what we want out of this test. So again, stretch your arms out in front. And as you bend, you're going to come down and you're going to hold your rib cage over your pelvis. Great, that's it. Now, keep that position. I'm going to let my hands go. I'm going to watch, can she keep it while I let go? Very nice. And then stand back up and stand tall. Good. And you can let your arms come down. So that's one of the major things that we're looking at, is can they go into the squat? The other things that you're going to look at too are everything. So how is the whole rest of their body? Even if it's not related to the test, it's good to start gathering that information about the client. So you might see, and her leg alignment was fine, but you might see that the knees and the feet collapse in toward the center, or maybe it only happens on one side. The feet may roll out. You have different variations there, so you'll want to make notes to the side. And this is one of those pieces of information that you're going to write down, because if she gets a 2, I may not know why she got a 2. Was it her torso position? Was it her leg alignment? Was it that she couldn't go very deep? What was the point that was taken off? So make sure you write that off to the side, unless of course the test is done and it's perfect, then you don't really have anything to write there. That also brings up how you're going to record the information for your problems. If someone gets a 1 or a 2, it needs to be represented in the problem list. If they got a 3, obviously they did it fine and there's nothing to write down. But if a 1 or a 2 is given as a score, make sure that shows up in the problems and then subsequently turns into one of the goals. Okay? All right. We're going to go into now the full squat. And this is a little bit different. So on the half squat, we're looking at body alignment a little bit more. Now we're going to add in the component of leg strength. So can they squat all the way down and all the way back up with good control? They can accomplish it, right? They don't get down to the bottom and can't get back up. And they can go in a full range with relatively vertical torso. Okay, I'm not as picky about this, but I certainly don't want them in this type of a position, right? We want to keep the body a little bit more upright, more vertical. So again, I'm going to have you, Eliana, take your arms out in front of you. Lower them down just a little bit so your hands are about the height of your shoulders. Good. And you're going to begin to bend your knees, and you're going to squat all the way down. Let your heels come off the floor, and all the way back up. Good. And let your arms come down. So that is really common. So if you notice when she did her squat, her heels stayed on the floor. And I'm really happy that she did that, because that is one of the most common mistakes that we see is people expect to be able to go all the way down, right, and get down to the bottom, but not lift their heels, which is not very reasonable. You're going to tip over backwards. So you need to let the heels lift when they need to. So the other extreme you might see is and then bending. So that might happen as well. So we just want it to be to the point where you do the half squat, and then you allow the heels to come up for the rest of the ride down. Okay? So let's do that again. So stretch the arms out and begin to bend the knees, and now start to let the heels come up, come down, and come right back up. Gorgeous. Very nice. Good. We'll do it one more time. Just one or two is fine. One, sometimes you can gather all the information. You might need to do it again just to see from a different angle, or sometimes people just aren't warmed up yet. So it's okay to give them a trial run to do it once and then do it a second time. So again, coming down and come right back up. Very nice. And you can see her body's position stayed the same. She didn't really tip forward or back, and she had a nice smooth movement up and down. So that's important. That's what you're looking for. From the front, I could also see her leg position, and her leg alignment was very accurate. So for that, I would give that a 3. For the half squat, I probably would give that a 2 because of the body position. And she was able to correct it. So you have to make a decision, how much information are you going to give the client? If you feel like they just didn't understand what you were saying, give them a second chance and give them a little bit more information. If they did seem like they really understood it, and they couldn't accomplish what you're asking, that then is going to be really their score. So I'm going to give her a 2 for that, because her tendency, and this is what we're looking at, what is her tendency when we approach movement, was to allow the body to come forward. And again, that's really common because we do a lot of weight training and different things where we're in positions. So that's a very common movement pattern that people might fall back to. It's familiar for them. Okay? All right. So now we're going to look at the heel raise. And most of the time we think of strength, how is the balance. It also has to do with the body alignment. So you might pick up that they actually have okay strength, and they have okay balance on other things that you see them do, but they can't do this very well. So take your attention both to what's happening around the foot and ankle, but also look all the way through the body, because that will give you a lot of information as to somebody's ability to do this. Now, I'm, just in the way that I do this, I want to be fair with this test. I often see people early in the morning where they haven't moved very much. So I often will do a little bit of a heel raise a couple of times just to allow people to move through the range of motion if they haven't been moving a lot before this. So you can choose to do that or not. I think that's kind of a nice way to allow them to experience the movement before we're testing them. So with your feet aligned just under your hips, you're going to lift and lower your heels a couple of times. And I can also watch, what does her body do with this? So I'm getting a little bit of information about how she's going to do in the test. Great. Okay. So you're going to stand on one foot, and you're going to lift your leg up. And people ask a lot, what do I do with this leg? And you can put your foot down for a moment. And a lot of times we have the holding on for dear life position. I think of this as the buddy system. You're going to get help from the other leg, right? You're going to help yourself balance. And it does help you. So we're not going to do that. We're going to take the leg and just hold it off the floor in a comfortable position that's not touching the other leg. All right? So go ahead and come onto your foot. Hold there for a moment. And we're going to lift and lower the heel 5 times. And that's what happens, especially when you're on camera. And 2. Good. And 3. Very nice. 4 and 5. Fantastic. Great. And put your foot down. So I would give her a 3 on that side. She had good control. She had a good range of motion in her ankle and had good kind of vertical posture, slightly forward, so she wasn't rocking back and forth a lot. Okay? So let's see the other side. So find your balance first, and then begin to lift and lower the heel. Yep, you get a freebie. Good. And 2, and 3, and 4, and 5. Good. All right. So I would give her a 3 on both sides. You can average that score, but also write down if for some reason, again, it was very different side to side, make a note off to in the column as to what you saw, why you saw it. And this is where you'll start to ask questions of, one side has very good balance and the other side, they're very wobbly. You might say, anything going on with that foot or ankle? And they'll often say, oh yeah, I sprained my ankle last year and I was hiking. But they didn't tell you that in the fitness history. So you can get little bits of information from them and write it down, because you're going to start building this background of this person. Okay? Good. All right. Okay. Some other faulty movements that you'll see is a lot of variations in the vertical posture. So what we want to see as people are lifting and lowering their heels is that they stay in almost the same alignment. So the rocking back onto the heels and rocking forward, that's one thing that you'll see. Sometimes quite abrupt. You'll actually hear their heels hit the floor. Other things that you will see are the knee bending when you're lifting and lowering the heel. So instead of the feeling of lifting up and down, there's a back and forth motion, the knee bends. We're starting to substitute other muscles for looking at how we lift and lower the heel with a straight leg. And again, that's going to be something that you're going to jot down. How does their posture change when they're doing this? How do they set themselves up? Do they start here? That might tell you something about the strength and awareness of how they organize their body over their leg. So start to write those things and make notes to yourself about that. All right. Let's go into the goalpost. So I'm going to have you come to the wall, and you're going to stand with your back against the wall. All right. Now, when you're lining people here, they don't have to keep their heels all the way back. They can allow their heels to come forward a little bit, not a lot, but a little bit, so that they can attain a vertical posture against the wall. And sometimes when people have their heels against the wall, it's just not possible for them to get to the starting position. Okay? So bring your heels a little bit more forward, a little bit more forward. Yeah, that's it. All right. So the first thing that I'm looking at is, how does Ileana's body, how does it touch the wall? So what I want to see is her neutral alignment in a vertical standing position, so that the back of her head, the back of her shoulder blade and rib cage area, and the back of her pelvis are all touching the wall. And there's the space between her neck and the wall, and a little space between her lower back and the wall. So that's what I want to see. That's going to get her her first point. If she can't stand this way, then I may not go on with the test, especially if her posture is very kyphotic like this. It might be inappropriate to start lifting the arms up. So that's going to be my first almost requirement to go on with this test. And from the side, she looks pretty good. And another way, and I'm going to get one thing. We're going to use the pedipole so that you can see it from the side. So Ellie, I want you to stand here, and I want you to look that direction. So you're going to come up to stand on it. and bring your pelvis back. You kind of have to find where it is. Exactly. So I want you to feel like this is the wall behind you. Okay? So you can see her pelvis is touching, and you can see there's a little bit of a space here. The area between her shoulder blades is touching. There's a space for her neck, and the back of her head is touching. So that looks pretty good. I'm happy with that position. Over time, one of the things I'm thinking about is I would like her lower ribs to just be able to get a little bit closer to, in this case, the bar or the wall or the floor, depending on where her body is. But I'm not going to force her to do that. That would be something I just make a mental note or a note on the paper, eventually working on bringing the rib cage down a little bit. So now we're going to be able to start the test. Great. All right. So go ahead and come back onto the wall. And get into the same position. So pelvis, rib cage, and back of head. Good. And that looks good. And one of the things that I'm looking at for the head position is that her gaze doesn't go up. Her nose and chin are in this position. They're not lifted as she's putting her head back. All right? So now we're going to start to look at her flexibility through her shoulders. So she's going to bring her arms up, and I often will have people bring their arms up in front of them and then bring them back to the wall in the goal pose position. So bend your elbows to 90 degrees and then just slowly take your arms and hands back toward the wall. So she does that easily. So I'm looking at how much effort does she use to get into this position. So she had ease with that. The next place I'm going to look is what happened at her rib cage. So if I'm looking here, I can see that it's different than where she started. So let your arms come down for a moment. So where she started was here, and as she brought her arms up into the position, her rib cage moved a little bit forward to help her get that last little bit of movement to get her arms back. Very, very, very common, okay? So I might ask her to do it again and see if she can keep her ribs back as she does it. So I want to see if she can do it, or she just didn't know about doing it. So I want to get more clarity there. So when you're there, before you take your arms back, I want you to feel how your body is against the wall, what's touching. And as you bring your arms back, I want you to maintain it the best that you can. All right, and she did that. So I'm going to go ahead and give her, for this part of it, I'm going to say that that was the full points for that. We're not done with the test yet, but I'm not going to take away a point because she, with ease, was able to do the movement. Okay? Now, you're going to keep all of that, and we're going to add on sliding the arms up and out into a V. Yep. And then come back in and come back down. And let your arms come all the way to your sides. Good. And again, I was watching to see from this position, did she change or was she able to keep her body alignment? And she did, with minimal raising of her shoulders. Again, we're not asking for the shoulders to be depressed heavily. We want to have some freedom of movement around the shoulder joint. And she was able to come up with ease and with keeping the body position. So I would give her a 3 on that. I'd still make a note off to the side, though, that her tendency right in the very beginning, just as many people do, was to add a little bit of thoracic extension to make it easier to get her arms to the wall. So I may address that in later sessions, but right now it's not enough to take away a point, okay? All right, so we're going to continue on. So we've done several things in standing, and now we're going to go on to the floor, and we're going to look at leg and hip flexibility and mobility on the floor in seated. So the first movement that we're going to do is the long sit. So just a very standard sit with your legs out in front of you. And again, the very first thing that I'm going to do is look at her body alignment just as she sits down. So often people will sit with a fairly erect posture because we're looking at them and they're in a place of fitness. You kind of have to extrapolate a little bit too, is like, what would they naturally do? So when they sit down, what would their natural posture be? Because again, you're trying to build a story about this person. So then you're going to ask them to, with their legs in front, sit tall on the sit bones to the best of the ability, and you're going to look there. And what you're looking for really is the position of their pelvis. So if you could imagine the skeleton there, that they're at least getting their pelvis to a vertical position, where they're sitting right up on top of their sit bones. So very common, roll back a little bit, that this is the best that people can do sometimes due to their hamstring flexibility. So that's okay. They would get a 1 because they can't get up to their vertical posture. Ileana can. She can get up to sit on her sit bones. So that's a 2. She's got a vertical posture and a pretty vertical position of her body. I'm looking also at what's happening to the curves of her spine. So I am noticing a little bit that her lumbar spine is a little bit more biased toward flexion, and her thoracic spine is a little bit biased toward extension. So that's telling me she's either got some spinal mobility issues, some leg mobility issues, or she's using her muscles to try to pull herself up on her legs. I don't know what's happening yet, but I'm just going to take note of that because it may come back in the end to tell me something else in a different test. So then to get a 3, we're going to look at your client's ability to go forward from their hip joints. So Ileana, without rounding your spine, hinge forward from your hip joints and then come back up. And do it one more time, hinging forward. And you can see how there's a point where her pelvis stops moving and her body continues. So I would say in this test she would attain a 2. She wasn't really able to hinge forward from her hip joints without changing her spine position. Now I have to say, a lot of times people say, oh, well the client got a 2 on the long sit. A 2 is 90 degrees of what we would call straight leg raise or hamstring flexibility. That's really good, actually. For most people, getting a 2 is great. So if they get a 2, I kind of think in my head, yeah, their hamstring flexibility for just the average day, you know, of getting in and out of the car and, you know, playing and doing and running is fine at 90 degrees. We'll always take more, but this is actually pretty good. Where we don't want people is way back here, and that's the best that they can do. So we're going to work for the 1s to improve them to at least get up to a 2. All right, our next one is the seated abduction, or I call it a straddle because that's what people are often familiar with. So in this same sitting position, you're going to open your legs as wide as you can. And in your manual, it talks about having someone do this sitting up against a wall. And you can do that, but it's absolutely fine just to test them right out in the middle of the studio on the mat that you're on. You don't have to go and sit next to the wall. It's easy enough to see their position of their body without the wall helping you. And you've also looked at them already in the goalpost. So it's okay to do this in the center of the floor. So what we're looking at is the flexibility at the hip and the musculature through the inner thighs. And you're not going to take points off for the hamstring component. So if they're a little bit back behind their sit bones, and Ileana's not, she has great flexibility here, but if they were back a little bit, you might think, wow, well, they can't get up on top of their sit bones, their pelvis isn't vertical. And that's okay. You've already noted that in the hamstring component of the long sit, so you don't have to take another point off. We don't want to take points off for the same thing that we've already looked at. Okay, so we're just gonna look at how much she can open her legs. So the ideal is a total of at least 130 degrees. Now you need to get out your protractor and put in your pocket protector, and we'll do a mathematical equation to figure this out. There's actually pretty easy ways, a few different easy ways that you can kind of eyeball this and have an idea of it. One is, actually do look at something that is a 130 degree angle, so you're at least familiar with that you know what it is, okay? So if we think of 90 degrees, that's easy, right angle, 90 degrees, it would have, you know, this type of a look. If we looked at that as her legs like this, then we would know that from center, she has 45 degrees on one side and 45 degrees on the other, which would make 90. Okay? So we need more than that, though. We're going for 130, which is 65 degrees on one side plus 65 degrees on the other side. So you can use, what I often do is think of a line coming directly through her center, and you could use the mat for that, or sometimes the mats have stripes on them, you can use that. And then going out to the side, if her leg was all the way to the side, that would be 90 degrees on that side. Okay, we don't need 90, we only need 65. So somewhere between 45 and the full 90 would be where her leg needs to be if you're just going to eyeball this, okay? So I would give her, see if you can get the legs just a little bit more open. Can you push them just a little bit more? You got it. Great. And I'm happy with that. I would like a little more, but I'm okay with that, okay? So she's got good flexibility out to the sides with my eyeball. All right? Good. All right, we're going to keep going. We're going to start looking now at the hip joint specifically, and we're looking at both internal and external rotation in this Z sit. And it's the position we often use for the mermaid exercise. It's a very common position that people sit in just when they're sitting on the floor. And we're going to look at both sides, and we're going to look at the body in response to what's happening at the hip joints. So we're going to come into this kind of side-swept position with one leg in the front and one leg to the side. And Ileana, I'm going to have you bring your front foot a little bit forward and align your shin with the front edge of the mat to the best of your ability. And the same thing with this back foot. So move your foot a little bit to the outside so you can square yourself off. Right. You okay with that position? Good. So that helps you to be a little bit more consistent with your testing. As the feet are closer to you, it's a little bit easier. So if you can get the two legs to be in line with the mat, you'll be testing people more similarly, and it'll be a little bit more consistent in what you find. So what I'm looking for here, first off, is her ease with how she's sitting here. And you'll often see people in this test, especially if they don't have very good hip flexibility, and they're in a position that's kind of like this, and they're struggling to stay up, and their face is often kind of scrunched, and they're working a lot to be in the position rather than just being in the position. So that's one of the first things I look at, because that tells me how comfortable they are. Okay? The next thing that I'm going to look at is her torso alignment. As long as she has ease in her sitting position, I'm going to look at her torso alignment. And this looks pretty good. So her rib cage is balanced over her pelvis. Her shoulders are balanced over that, and her head is up, and she's pretty much vertical. If she had not enough flexibility in either this hip or this knee, her hip might be up a little bit, and her ribs might shift off to the side a little bit because it's difficult or painful sometimes to internally rotate enough through this hip to be able to get up to that vertical position. So that's very, very common. And some people, you'll see that it looks like it's their hip, but actually they'll complain of pain in their knee, like a strain, because they're not used to being in this position. So she looks very good there. And we're going to do this from the back as well so that you can see the position. So turn around and face the back. And you can see, again, how her body is vertical. Now, what you might also see is that there is a little bit of space between her right sit bone and the floor. And a little bit of space is okay. You don't have to have both sit bones absolutely pressed into the floor. That's not as important as what's happening in her spine. So you might see a little difference there. Don't take points off for that if the spine and the pelvis are aligned vertical. So that's what we're looking for. And you can think about, why this might be important. From this position, we're going to go into spinal mobility exercises, right? Especially if we're going into the mermaid. And you want to be in your best neutral alignment, right? Your optimal alignment with axial elongation before you would go into any spinal movement. That's the same also for the long sit. If somebody's in long sit and their spine is very collapsed because they can't get up to their vertical position, it might be unsafe to give them a lot of articulation exercises from that. It's not a very good starting position. So we want to see, can she do this? This might be the place where, especially if you're doing a screening and maybe the person's going to go into a group class that you might not be teaching, if they weren't able to do this, you could offer them a box or a yoga block or something and teach them how to use that. So in the class, you're going to go and you're going to get a box and you're going to do the position sitting on the box instead of sitting on the floor. So it's an opportunity to give your clients a little bit more information and educate them so they feel empowered when they go into a class. Our next test is the roll up or the roll down, and really that's just from where you're starting. So we're going to, for right now, call it the roll down because she's in sitting. And I started in sitting often because it's a little bit easier for people to roll down than it is for people to roll up. So I want them to be successful. I do see a lot of people who are deconditioned, and to roll up from the floor is often very challenging for them. So I want them to have the positive part of it first, and then we'll do the part that's probably a little bit more difficult for them. So Ileana, raise your arms to about shoulder width apart and sit up a little taller right on your sit bones. Great. So you're going to smoothly roll yourself down to the mat. Very nice. And then let your arms come up. And the same thing, with that same quality, I want you to look forward as your fingertips come forward, and you're going to look to the wall in front of you, and then come back up. Great. And that was very nice. So you're looking for their ability to have pretty good segmental movement. Not as much as we would train somebody when we're working with them as our clients, but just pretty good segmental movement that she can roll back through her pelvis, her rib cage, and the back of her head. And she came up with that same smoothness, which is what we're looking for. So I would give her a 3 on this. I would make some notes to myself of being able to get a little bit more length through her hip flexors possibility and looking at her gaze, but generally this was fine, and she gets a 3 on this. So let's do it one more time. Stretch your arms out, and again start to roll backward, so the pelvis, and then continue. Good. All right, very nice. Let your arms come down beside you and just rest there. So as we're looking at this spine mobility, again, we want to see, and one of the things that you can note is, do they have more mobility in one part of their torso, one part of their body, than another part? So you might see that they really can flex through their upper back. They may not have the same mobility when they're moving and initiating from the lower back. So you might be able to take some notes again off to the side, or even just in a separate place, just where you're keeping some other information about this person, because again, that might be helpful later on when you're thinking, wow, now where did she move? Now she got a 3, but was there anything else that she could improve upon later? And so that's helpful when you take that information down. So we're going to move into the 100 now. And we're not actually teaching the clients how to do the 100. So sometimes we think we should be telling them about the arm pulsing and all of this about the 100. What we're really looking at is their ability to be in the 100 position, the long lever position of the curl up, and be successful with being able to be in the position and the breathing. So I want to see, can people breathe? Because that's what they're going to have to do in the exercise for that long period of time, the 10 breaths in and 5 breaths in and 5 breaths out for 10 times, that 100 breaths. I want to make sure that they can really do that, and they understand the position, and they have the strength and awareness to be safe with it. So in the beginning, I actually teach something a little bit different. I look at the breath work first, so that it's kind of giving them a fair chance to understand what I'm talking about. So Ileana, bend your knees and put your feet flat on the floor. And I'm going to ask her just to do a couple of different breathing styles that will help for her and for your clients to understand this a little bit better. So I want you to inhale and exhale, right? And I want you to have the sensation that you're going to expand your belly. So inhale and exhale. I'm not sure if you can see from the camera, but she's not really expanding her abdomen. You can see that her rib cage is rising toward her head and back down. And that's actually the opposite of what we want. It is what we do see, though. So you will often see, and you'll ask clients to take a belly breath or to allow their abdomen to expand, and they will instead hold it fairly tight and expand their rib cage with a lot of accessory motion. So this is not what we want. We want to keep the sense of being able to expand the abdomen. So keep doing your inhale and your exhale. Right, and you started to change it, so that's good. So instead of letting this rise up and down, let your abdomen rise into my hand when you inhale. Great, really nice. And then exhale, let this go. Inhale, let this rise. Very nice, and let it go. And that's actually really important to be able to allow the abdominal wall to have that mobility. It helps with keeping the organs mobile. You don't want to have just a fixed position of the abdomen. So that's very important. Aesthetically, sometimes people don't want to do it, all right? It doesn't look good to have your belly sticking out, but it's important movement to be able to do. All right, so that's the belly breath, and often we do that in relaxation, in certain forms of meditation. It's advantageous to do that belly breath. It is not advantageous to do that in the middle of the 100 though, so we don't want to leave our clients with that. We want to take them up to the next level, which is what they're actually going to use, which is the rib breathing, right? So if we can get that three-dimensional expansion of the rib cage, then they don't have to let the abdomen move quite so much when they're doing the 100. So now, Liana, when you breathe in, I don't want this to move quite so much, and I want you to focus on breathing out into my hands, and then exhale softly. Good. And inhale into my hands, and exhale softly. Great, that looks really good. So now we're going to put that together with some parts of the 100. And the 100 is a very famous or infamous mat exercise that is going to use these components. So first I'm going to have you keep your legs right where they are, and you're going to curl your head, neck, and shoulders to look through your legs and let your arms reach there, just to your lower ribs, just about there. So now breathe in just like you did before, and exhale. And feel that outward or lateral movement of the rib cage and down. Right, good. And I'm just going to have her do it 1 or 2 times. I just want to see, can she do that when she's there? And she did fine. Okay. So now I'm going to make the challenge a little bit more. I want you to bring your legs up to 90 degrees, the tabletop position. Okay. So I'm going to go the same thing. Curl up, take a couple of breaths in and out, and I'm watching, where does she direct her breath? Does the abdominal wall move, or is she able to maintain the abdominal wall fairly quiet? Not moving at all. The abdominal wall can move, but with control. And I want the most of the breathing to happen in the rib cage. So again, roll your head, neck, and shoulders up. Lower your arms just a little bit, right to there. Good. So now again, breathe into the rib cage and breathe out from the rib cage. Good. She's not allowing her abdominal wall to move very much, so that's great. Now if you feel like you can keep doing that, extend your legs out to about 45 degrees. Good. Inhale to the rib cage. Exhale, and then lower your legs as low as you can go without letting your back arch. Lower your arms just a tiny bit. Take 1 more breath in and breath out. Fold your knees back in and roll down. Good. Feet to the mat. She did a very nice job of that. So she was able to maintain the curl up. She was able to maintain her legs fairly low, and she was able to maintain her abdominal wall, again, fairly still, fairly quiet, and breathe a full breath in and out from her rib cage. So that's great. We often ask for the legs to be very, very low, almost touching the ground. And sometimes in the very beginning I don't do it quite that low because I'm not sure how their body's going to react. But she was able to go lower than 45 degrees. I would give her a 3 on this. I'm sure she could have gone lower if we'd gone a little bit longer. So that's the 100. And again, not teaching the 100, but really looking at these components. But it's what you will see often. People are good to a certain point, and then all of a sudden, the lower back starts to be drawn off of the mat. So that's one of the faulty movements that we're looking for. We don't want to see that pull of the pelvis. We want to see the core control, right? The appropriate core control to maintain the body in the position of that slightly flexed spine. Our next test in the screening is the side lift. And side lift is pretty challenging. So we want to make sure that people are really set up in the best way so that they can generate the strength to lift their body off of the floor. So she's going to have to use her outer leg muscles or abductors. Her obliques and her trunk muscles are going to have to work a lot to be able to lift the rib cage up, and her shoulder, there's a lot going on in the shoulder. So it's a complex test. If it's easy, you just lift your hip up and down. But there's a lot of things to look at. So I'm going to start up at her shoulder. And the first thing that I'm looking at is, can she align herself so that her shoulder, especially the feeling like the head of her humerus, is in the socket the best that it can be. So if her shoulder was pushing forward, I would immediately correct that and pull that back, and that looks great. And even right now, the body is working a lot. There's a lot going on. I'm also going to look at her rib cage, which looks fine. Let your rib cage sag down a little bit. Let it sag kind of the yucky way. Yeah. So you might see this from your clients. So make sure that you're asking them to lift their ribs and to pull the head of their humerus, the front of their shoulder, back a little bit. Now, if that wasn't enough, she's going to hold this, and we're going to look down at the legs. So her legs are an elongation of her body, and her bottom foot, I want the ankle to be neutral. So sometimes people will let their foot collapse down, and it's almost like they're standing on their outer side of their leg. We don't want that. It's not really great for your ankle or for your knee. So you want to stand on the side of your foot and press there, and you can bring the top leg like that as well, so they kind of match each other. That's it. That's great. All right, so she's in a good starting position, so lift this up a little bit more. Now, you're going to start to lift your hip up. You're going to press down into the floor, and the first thing I'm going to look at is, can she do this? And she can, so she can come back down. All right? There are oftentimes people who are really deconditioned who cannot do this side lift, and so we need to really work on their total body strength and their awareness through their shoulder. Okay? So we're going to go again, and we're going to add on this time. So shoulders in good alignment, ribs are pulled in the front, so pull your ribs back a little bit. Lift your hip up, standing through the outer side of your foot. Now lift your top arm and top leg and hold there for 3, 2, 1. Let everything come down and rest gracefully. Good. No flop down. Can't flop down. Great. And then come up to sitting, just so you can come into the mermaid position to sit. So again, if they can come into the side lift position and lift their hip up, that's great. I really am happy. I don't always need, just for the people that I work with, for them to be able to lift their arm and their leg. If they can, that's fantastic. But I'm often really happy if they can just lift their body up into the side plank with good control, because that's quite a bit of work. I would expect the arm and leg lift from somebody who has really good core control and awareness. So again, don't hold it against anybody. If they only score a 2, that's okay. It's good for that. So again, special attention to the shoulder, special attention to the foot. So we're setting the body up in its best alignment for the side lift. All right, Ileana, I want you to come into position lying down on your front. Good. And we're going to go into the push-up. So you're going to bring your hands to the side and just press yourself up onto your knees. Just come up into like a quadruped position. So just come up. Yep. And then turn your toes under. So you're going to go into a push-up position with your toes turned under. So turn your toes this way. Yep, you got it. And you're going to lengthen your body, and you're going to go out into your plank position. Lift your knees. Nope. Just into a normal plank. So lift up like you're going to do your push-up. Yep, you got it. All right. So from this plank position, what we're looking at is a long diagonal line. Okay, I don't want to see the push-up position starting with the bottom up like this. It looks more like you're going to do downward dog from yoga. So we want to come into the long stretch position. If you're familiar with this exercise on the reformer, bring the back of the head up just a little bit. So you're going to reach this part up toward the ceiling. Look down toward the floor and lift your neck up. Yes, gorgeous. So there's a length between the head and the feet. From this position, once she's here, I'm going to have her bend her arms, and she's going to do one push-up down toward the floor, and then come back up. And I'm going to have you do one more. Go as far as you can, and then press away from the floor and lower your knees and sit back in child's pose. So she was able to go down about halfway, which is, again, very normal, right? We don't always see people who can do a full push-up all the way down and all the way up. So because she only went down halfway, she's going to get a 1. We want to have her be able to go all the way down and up to score the 2 and the 3. The 2 is all the way down. The elbows not quite as close to the body as we'd like them. So we're using a little bit more of the chest muscles to do the push-up rather than the arm muscles. That's the 2. And the 3 is to come all the way into the position where the elbows are reaching down toward the heels, all the way down and all the way back up. Now, not only do they have to be able to do that, but they've got to maintain that elongated position. So if in the middle of it there's a sagging of the hips or a sagging of the rib cage or the head, again, you're going to take some points off for that, and you're going to note that in the side. So make sure you write that down as to why you're taking off the points. So all the way down and all the way up. I will sometimes do this from the knees. It changes the exercise a little bit, but I want to see, do they have the upper body strength and awareness to lower their body down and to push back up, which often people will have. They just can't quite do it from their feet, but from their knees they can do it well. So you may see somebody who in their push-up can't quite get all the way down and back up from their feet, but if they do it from their knees, they can. That gives me some information to work with. It's a little different. The angle is a little different. It's not exactly the same, but you'll know how much work you have to do to get them to be able to do the push-up, right? So we're looking at, again, upper body strength, trunk strength, and awareness. Do they know when they're off in their position? Okay? So come and lay all the way down on your front now. And we're going to go into our next test, which is the Superman or the Superwoman. You gotta have a gender specific. So Ileana, I want you to stretch your arms out to the sides like a T. And the legs are elongated behind. So you'll see people start this way. Before you go into the test, make sure you ask them to lift their forehead and nose a little bit off of the floor. Right. So you have that elongated position. So it's as if she was standing up. Her head is in the same position, not forward. So that's going to start the test. You're going to lift your hands a little bit off of the floor, and now you're going to allow your upper body to go into an arc, and at the same time you're going to lengthen your legs and lift up. Very good. And come back down. And turn your head to the side. Rest your body. So what we're looking at now is a couple different things. So we're looking at her ability to move her thoracic spine into extension. We're also looking at what happens to her head, neck, and shoulders while she does that. Can she keep the elongated position, or does something happen while she's doing that? And she did a nice job of maintaining that. The other thing we're looking at is her hip extension. So can she float her legs out and up without involving her lower back? So we want to see this move. We want to see movement at her hips, but we don't want to see increased extension at her lower back. So let's do the test again so everybody can look for that. So allow the forehead to hover off the floor. That looks great. And now let your arms start to float up. Your breastbone is going to begin to look forward. Your legs are going to lengthen and lift. She's able to clear her thighs. She's able to clear her body. Good. And come back down. And we'll do it one more time. So look specifically now here as she comes up. I want to see this stay elongated as she comes up. And she's doing a pretty good job of that. Again, you're not looking for no movement. That's a little bit extreme, but I don't want to see there to be a buckling. So that might tell me, if she is doing that, that she either is lacking some flexibility or possibly lacking a little bit of core control to control the pelvis and the lower back. And she did a nice job at that. Very good. All right, so take your arms now. We're going to go into our prone shoulder flexion, and you're going to reach your arms overhead into the mat and just relax down, and you can let your head relax down. All right, so now we're looking at her ability to go from this position to a lifted position. So if you were looking at this in upright, I would be here, starting on the floor, and then I would lift my arm here. What I wouldn't want to see is a lot of shoulder movement in elevation and internal rotation of the arm, which will often happen. Okay? So turn your arms so that your thumbs point to the ceiling. Very good. Now, without changing much of the rest of your body, I want you to let your arms float off of the floor and then come back down. Good. Do that one more time. Take your arms a little bit wider apart. Just a little bit before you lift, just take them open. And do as little activation here as you can. So lift from underneath your arm to lift up. Good, lift a little bit higher. And then come back down. Good, and she did fine with that. There was a little bit of more recruitment of her upper shoulder muscles than I would like, but it was fine. It didn't deter from her ability to lift her arm. We talk a lot about hip disassociation. You can let your head rest. We talk a lot about hip disassociation. We don't always talk about shoulder disassociation. So this is one of those times where I want her to be able to move her arms without moving her body. It's the same as we would do with an arm arc, but now it's a little bit more challenging, and she was able to do that just fine. You might need to, in this test, turn somebody over and have them do this test in supine. Many, many, many students have told me, there's an error in your manual. Did you know that there's something incorrect? It says that you do this test in supine, and it's not an error, it's not a mistake. We do that on purpose for people who don't have enough shoulder flexion, range of motion, or mobility. If my client, and I would see this already when we did the goalpost test, but if I know that my client can't raise their arms higher than this, it would be really inappropriate for me to lay them down on the ground, because the ground is going to push their arm that much higher. And they may not have the range of motion, they may not have the flexibility, so I don't want to put them in a compromised position. I'm going to have them do their test lying on their back, and then you can measure the distance between their hands and the floor, and you can keep track of that to see their progress. Okay? All right, so now we're going to come into the same push-up position with your hands beside your rib cage. We're not doing a push-up, so you don't have to go anywhere yet. Everybody gets nervous. You're going to test me on the push-up a second time? That's not fair. And we're going to do the prone press-up. And we're looking again at thoracic extension. I'm also looking at how she gets her body into what we call the swan position, how she is able to lengthen through the front of her hips, how she maintains enough control at her abdominal wall that she doesn't sag down, but also not so much contraction that she accidentally goes into flexion, which sometimes will happen. So Ileana, on this next one, I'm just going to have you come up to a point where you can keep your lower ribs on the mat. So you're not going to come higher than that in this first one. So you're going to start to look forward, just a little, not quite so high. Still look at the carpet. That's great. And then come up as high as you can without letting your lower ribs come off of the mat. And then roll yourself back down rib by rib by rib. That looked very nice. So again, you're looking at how much can she move into thoracic extension without going into lumbar extension. We want to do just thoracic. So let's do that one more time. So the head, again, she's starting with her head off of the floor, and she's going to begin to come through the rib cage just to stand at her lower ribs. And then roll back down. Very nice. That looks great. Now we're going to continue, and you're going to press all the way up towards your knees. So we're going to look at her all the way through this. So starting to come up. So now you're going to press into the floor, and you're going to allow your body to come away from the floor. Allow your hips to come away from the floor, and then roll yourself back down. And rest when you get to the bottom. Good. So now we're going to progress this into the full position. So we often call this the swan. It's the swan exercise from the mat work. And you can stop at different points along the way. Really what you're trying to attain is, can they get extension that matches their lumbar extension, a little bit of hip extension, so you have an elongated line. So with your hands pressing down, start to let your elbows reach away. And you're going to go through that same press up that you did before. And now you're going to continue by pressing down in your hands and keep coming up, and just look straight ahead and pause there and open your shoulders a little bit more. Great. Keep looking forward and begin to roll down across your thighs, then your pubic bone, then your belly button, then your ribs, and you gradually roll rib by rib by rib all the way back to the starting position. What you'll often see is a lot of extension in the lower back and not much extension in the upper back. I would make some notes though that it took some, as I call, negotiation. There was definitely some conversation going on in her body. So I know she could do it, but it wasn't just up and down really easily. She actually had to work at doing that, and that's okay. And I just want to make some notes to that. So let's do it one more time. Reach the elbows away and start to look forward. And not quite so much yet. Look more at the carpet. And then continue to go up and feel length through the front of your body as you look forward. Open up here. Look forward with your eyes. Look forward with your collarbones. And lift your abdomen up a little bit more. Keep lifting your breastbone. Keep lifting your breastbone up and out. Right. Good. Let this come down just a little bit. Keep lifting up off of my hand and begin to roll back down. Lengthening the front of the hip. Lengthening the body. Lowering the feet to the floor. And coming down. Our last test now is to look a little bit more at her hip and quadricep flexibility. So we've done that a little bit now in both the Superman and in this prone press up and into the swan. We're looking at how does the front of the thigh and the front of the pelvis lengthen. So we're going to look a little bit more specifically now at the quadricep. And Ileana, I'm going to have you reach back, use your left hand to grab a hold of the top of your left foot. Very good. And she did that with control, which is great. Oftentimes people will do a big reach around or their knee comes way out to the side to try to get their foot. Ideally, what she did is the way that you would like people to do that. So from this position now, my main gaze is at her lower back and pelvis. She's going to begin to lengthen her knee and let barely the top of the knee here come off of the floor. Come a little bit more if you can, and then let it come back down. I'm going to do that one more time. And as you do that, I want you to keep your pubic bone in contact with the floor. So as you lift the thigh, keep the pubic bone in contact, and then come back down. And you can see there's some movement here at her lower back and her pelvis. It's not a lot, but it is a little bit. I can tell that this is, as she's going into the position, she's getting a little bit of lumbar extension. So let's do it one more time. Keep the pubic bone. Yes, now maintain that and only lift the leg as much as you can maintain that. Whoop, go back with the pubic bone just a little bit. There, now hold that and see if you can lift the leg more but without letting this go. That's better. And then come back down. So I'm really watching here to see what's going on. Let's see the other side. So let go of that side. Let's see the other side. I'll get out of your way so you can reach back with the right. Okay, so the first thing I want you to do is connect your pubic bone to the floor. So that's going to do two things. One is going to start to activate the muscles that are going to hold her there. It's also going to give her a little bit more abdominal support that's going to help her maintain the position. So you're going to start to lift and lengthen the knee without losing that contact of the pubic bone to the floor. Right about there and stop. And then come back down and do it one more time. And I just have my hand there because sometimes I can sense what's going on easier than I can see. And back down. Good. And let the leg go and let your hands come back around. And let your body rest there. And you can turn your head to the side. So it's just a little bit of tightness in the front of the hip. I know that's a challenging place for her though, so it is something I want to work on. So I might give her a 2 on each side. She did okay. So now you've looked at all of those tests. You have all of your information. You have circled 1, 2s, and 3s. Possibly you've circled some 0s for the tests that you may not have somebody do. You're going to go through and look at this in regard to parts of the body. There's lots of different ways that you can develop your problem list. I like to look at all of the tests that kind of tell me the same bits of information. So I may look at the half squat and the full squat together and see what that information is telling me. I might look at the goalpost exercise and the prone shoulder flexion to give me some information about her shoulders. And go through and start to get themes of information. So if you notice that you've written down decreased shoulder range of motion a couple of times, that's important. You're going to put that together to come up with that problem. And many tests will tell you the same pieces of information, which is really good and reassuring, and it tells you that you're looking at it the correct way if each test supports the other test. Again, once you have your problems listed, then list your goals. Basically, you're just changing how you're describing the problem. The problem is decreased something. The goal is to improve or increase that. So it's very clear. Include your client's goals. Those are really important. And then with that information, you'll be able to build your exercise programs for each of the 3 time periods. And you'll be able to see a very clear progression. You'll be able to see the goals are met at that last exercise plan. And this is going to help you to really target and work with the person in front of you. You could give them a general Pilates program and it'd be really good. They'd really benefit. But you can give them your general Pilates program with attention to these specific pieces of information in their body, and they're going to do even better. I hope this was helpful. I hope that you have an easier time going through the screening. We'll see you in the next time.